So median nerve block. Okay, purpose. A median nerve block provides anesthesia to the thumb, index, long finger and half of the ring finger distal to it, okay, but not the dorsum of the hand, okay, but not the dorsum of the hand. So this is the picture showing the hand innervation, okay. This is a dorsal view, this is a dorsal view. So ulnar nerve is the yellow, this is the ulnar nerve, and radial nerve is red, this is radial, okay, and blue is the median, okay. This is the picture which you need to draw in your exam, okay. After drawing this, after understanding this picture, if you read this statement, it will be easy for you to understand this, okay. A median nerve block provides anesthesia to the thumb, okay, index, long finger and half of the ring finger, okay, distal to the proximal interphalangeal joint, okay, from this region, okay, distal to the proximal interphalangeal joint, but not the dorsum of the thumb. Look at this, the dorsum of the thumb is supplied by the radial nerve, okay. So this is the picture which you need to practice again and again, because if at all the patient comes to you with a particular injury, the first thing you need to do is to mark which nerve is supplying that area. So this picture has to come to your mind instantly. And this is the palmar surface again. So this is the radial nerve, this area supplied by the radial nerve, okay. This is supplied by the ulnar nerve, okay, and this area is supplied by the median nerve. So this is another picture which you need to practice again and again. So again, patient positioning is palm up position. The median nerve transverses between the flexor carpi radialis on the radial side and the palmaris longus tendon on the ulnar side, okay. Flexor carpi radialis and palmaris longus. So these are the two tendons you need to identify. Between these two tendons is going to be your median nerve, okay. When the patient makes a fist and flexes the wrist, the palmaris longus tendon is the more prominent tendons of the two, okay. So as we go through this particular seminar, what I am trying to tell you, just practice on yourself to identify the tendons I am saying, okay. So close your wrist and flex the wrist, you will be able to see there are two tendons here, right. There are two tendons. The most prominent tendon is your palmaris longus, and radial to that, okay, radial to that is, or lateral to that is going to be your flexor carpi radialis. Between these two is your median nerve. So method is raise a wheel of anesthetic in the subcutaneous space between the PL, palmaris longus, and the flexor carpi radialis at the level of the proximal palmar crease. Insert the needle until you feel a pop of the deep fascia and then inject somewhere around 3 to 5 ml of anesthetic. Of course, if the bone is felt before the pop, withdraw the needle 2 to 3 mm and inject the solution. To increase the probability of a successful block, withdraw the needle back to the skin, reinsert directly the needle 30 degrees both medially and laterally and inject an additional 1 to 2 ml of anesthetic solution, okay. But nowadays you can use your ultrasound also to exactly localize where that particular nerve is, and you can directly give local anesthesia just encircling that particular nerve. Understand, the palmar branch of medial nerve is actually superficial and can be blocked also by withdrawing the needle at the subcutaneous space and injecting 2 to 3 ml of anesthetic solution at the subcutaneous level itself, because this particular palmar branch is more superficial than the median nerve, okay. To block both the nerves, the median nerve and its branch, the palmar branch, you need to not only block the median nerve, you need to come back to the subcutaneous surface and you need to block the 2 to 3 ml as well. So if at all a median nerve block is kept for you in an exam, it is for you to identify and understand and tell this palmar block as well, otherwise you will not be given the marks.